Hello, and welcome to the second episode of Global Health Direct, where we focus on global issues related to healthcare by getting local perspectives. In this episode, we have two individuals from the organization FIMRIC to talk about their global health experiences. Our fun fact for this episode is that the summer classic, the ice cream sundae, was actually invented by getting around a ban on ice cream sodas, replacing the soda with syrup. Just another example at the persistence of sellers, but this time with a very tasty outcome. Our first guest is Vikram Baru. Dr. Vikram Baru is a founder and chairman of the board of directors of FIMRIC, a practicing physician and senior healthcare executive with an extensive background in telehealth and healthcare technology. He is currently the chief operating officer of Kosejo Sano, the only true multicultural, multilingual patient engagement solution in healthcare. Our second guest is Daphne Coledron. Holding a bachelor's degree in marketing from the Banking and Commerce School in Mexico City, she finished her master's in international peace studies from the UN University for Peace in Costa Rica in June 2017. She is certified in public health and is currently getting certified in project management. Daphne is passionate about contributing to peace building around the world to help others and to tackle these problems at the grassroots level. So I'm very glad to have both of you speaking tonight and being able to have this opportunity. I guess we'll just get right into our first question, which is, how do you define global health?
Thanks so much, Ashwin, for the introduction and for the invitation to the podcast. Hello, everyone. I guess I will start with what I consider to be my own definition of global health. I think that it's a holistic discipline that makes efforts in transnational health, focusing mainly on prevention and clinical care, but more from an individual point of view. For me, global health has the main objective to achieve equity on access to healthcare for every single individual on our planet.
Great, and I'll go next. Again, thanks for the invitation as well. This is Vic Bakru. To me, global health really represents an opportunity, and it's an opportunity to improve the health of individuals around the world. And when I think of health like Daphne, I think of it in a very holistic sense. So to me, global health is health of all people around the world and all dimensions of one's individual health. So everything from your mental health, emotional health, to your spiritual health, as well as your physical health, of course. So it really is a very holistic sense of meaning to me.
Okay, yeah, that was actually really interesting to hear about. Definitely, personally, I'm very interested in global health and hearing definitely outside perspectives, and those actually working directly in the field is definitely a good perspective to get, just to get a better sense of how it is practiced and actually applied in the real world, and how we can actually see it being acted out by organizations. And speaking on this term, what would you say FIMRIC does in terms of global health and kind of the impact that it has?
Well, for me, and I'm not only saying this because I work at FIMRIC and I love it, but FIMRIC focuses on the public good in general. It actually believes in a global perspective. I guess that as an organization, we have a scientific and an interdisciplinary approach. We recognize the need of like a multi-level approach for interventions. And that is why we work on education, health access, participation, prevention of diseases. And this is why we work at the grassroots level. The role of FIMRIC in global health is that it actually understands the need for, I guess, more comprehensive frameworks for health policies and financing that is needed around the globe. We do this globally, but also FIMRIC recognizes how important the role of community health workers or local workers are, like how essential they are for this mission. FIMRIC, to me, sets the example and allows people who want to make a change in the world to be part of this process of achieving equity on access to healthcare, by living the FIMRIC experience, regardless of your background or your education, which is why, global health is multidisciplinary, because we really need from everyone in the first place. And this is why we need from everyone in the field, and I believe that that's exactly what Finbrick does for global health.
Gosh, I couldn't have said it better, Daphne. I think that was great. I'll probably only add to that FIMRIC, as we call it, around the office and around the world, stands for Foundation for International Medical Relief of Children. And the organization started with a focus initially on children, but as we started to build clinics in different parts of the world, and as we started to create projects in the communities to build trust with them, to really understand the needs of the community, to survey those needs, to build solutions around those needs. What we started to understand was that to have healthy children, you really have to have healthy families. And healthy families translates into healthy communities. And so we really started focusing, I would say, a few years into the effort on finding ways to support the health of the entire community. Now, in Uganda, that may mean that we have weekly health groups that meet and talk about the health needs of the community at that moment. And so I believe that what FIMRIC does is ever changing. It really depends on what challenges are facing the community at any moment, and how we can be effective either on our own as an organization serving the needs of those communities, or partnering with other organizations and individuals, who are similarly interested in the health of the overall community.
Yeah, that's very insightful and very interesting to hear about how, kind of just looking at global health, how we can break it down to just a term that's, even in the sense it's literally called global, but we can break it down to just children and families and break it down to such a deeper level to see how it can be impacted and where this impact can happen. And it's good to see that, I guess, we can still have this kind of focus without losing ourselves in our goal and losing kind of where we're trying to go towards and what our focus is on. And I guess in terms of focusing on children and families and local communities, can you tell us about the places that you have worked in the local communities that you've been engaged in?
Well, in my experience, I actually started to work for FIMRIC like 2.5 years ago. I work right now in Restauración, Dominican Republic. So just for you guys to have an idea, we are located in a binational area since we are bordering with Haiti. So when I arrived, I started serving as a volunteer coordinator for FIMRIC, and later I became the field operations manager. So this is pretty much, like how I started my journey in public health and managing, like the projects dedicated to improve healthcare in underserved communities. So these communities, I want you to, like think of a very underserved community in the border of, like in the Dominican and Haitian border. We have a municipality that has around, I want to say that a little bit more than 20 little communities, or like 20 little towns. And we have around 7,000 inhabitants. Like that they might be, like registered, but we might have a little bit more of people due to the Haitian immigrants. At this point, like I'm not only, like working for FIMRIC, but somehow thanks to this position, I'm also supporting the municipal hospital and the rural clinic by serving as a point of contact, or using, like my networking just to facilitate delivery of medicine to these places.
Daphne is being very humble right now, but it's our field operations managers that do the boatload of all the work, and they're the ones who really keep the project sites running. If you've ever been to a FIMRIC project site, you know how central the field operations manager role is to the running of the entire program, and to the coordination of the various activities in service of the communities where we work. So I always have a tremendous amount of respect and appreciation for the work that our field operations manager, or FOMs, as we call them locally, do. In terms of my specific role, I'm a physician by training, and I ended up getting a degree, an MBA, in healthcare management. And so I've worked in hospital administration, as well as a number of digital health startups. And all of that experience really has tied back to what I learned in my various roles at FIMRIC. From the earliest of days, setting up some of our project sites, to growing and building the team, whether that be stateside or in the field, to then ultimately learning how to let go. We started to get founder syndrome several years into our organization's founding. and it took a lot of effort and courage to turn it over. And I think, the only reason I was able to do so was because we found an incredible leader by the name of Meredith Mick, who serves as our CEO today and has been CEO for the last 10 years. And prior to that was actually started her work in the company, actually, field operations manager, former Peace Corps as well. So nonetheless, that's a little bit, of sort of what my role has been over time. Hopefully that's helpful to those of you listening today.
Yeah, actually, one point that you brought up, that a term I've actually never heard before, you mentioned founder syndrome. I'm just wondering what that is and kind of like what that, I guess, just entails.
Sure. It's sort of a syndrome among those who start initiatives or programs or organizations where you are so passionate about the project that you are working on, that if you've done your job well, you end up attracting incredible people like Daphne, like Meredith, like, many, many others, hundreds others, over the years. You end up attracting great talent to the organization, and through typically your own observation, you understand that it's time to pass the torch. And that's a really hard thing for someone who has started an initiative to realize and to come to accept at some point in time. And I went through that evolution, having started FIMRIC back in 2002, 2003. And, at the time when I was ready to hand over the reins, so to speak, and ask another person to carry on this vision that we had all come up with over the first, several years of building the organization. It was through the, incredible talent of the team that was in place at that time that the founder, myself, felt comfortable moving on to other projects and taking on other roles within the organization and letting someone else steer the ship, if you will. And so that's what I mean by founder syndrome. But it was frankly made a lot easier, I think, for me because of how wonderful and incredible our team was at the time that I decided to step down from that CEO role.
Yeah, that honestly must be really difficult to step down, especially after you've done so much to just build it up. And it's kind of like your own creation, and definitely having to kind of just hand over the reins, or when your time's up, it's definitely really hard to let go. And I know that's something that can be especially difficult for people that have, especially with something like FIMRIC, how it has such a global reach as well. It's really hard to walk away from something like this, or just to let someone else have that position that you once had as well. And I'm glad that whoever's filling your seat for you now is someone that's very qualified, and you've been able to attract such qualified individuals. So it makes it a lot easier at the very least that, it's left in good hands and people that are very capable of kind of just continuing your mission and your values. And in terms of, I guess, just the work that's been done, especially, and the places you've seen, in terms of, I guess, just like the living conditions and the healthcare that's accessible and its own quality, what have you seen in these places that might contrast what we might see in more developed countries like here in Canada or other places like the US as well?
Well, I guess that perhaps Vic has seen way more than me, but I have seen a lot, and I'm just going to refer right now to the DR, just to the Dominican Republic and Haiti. And sometimes I have to be honest, I wish that I hadn't seen what I had seen. Reality can be really, really tough and hit you. These communities, they can, or the way that I can only describe them right now would be as precarious communities where literally in order for you to have, like an ibuprofen, you sometimes need, or you have to walk 2 or 3 hours to end up, arriving to a clinic where they're just going to tell you that they ran out of ibuprofen. So you just come back home with perhaps, more pain and with still no solution. So, I guess that the way the main contrast is that everything is so different. These communities, in them, you can only find, around 30% of access to water. And when you have running water, it does not even arrive clean. We're supposed to have around 15 rural communities, one per town, and we only have 7. And from the 7 of them, you might not find all the medicine. We're we're talking about places where around 80% of the people have no toilets. So having a toilet is, like just for the elite. This is a luxury. We still have a lot of teen pregnancy. Access to electricity is something that, unfortunately, we're around, I think that 48 or something percent, around that, of people not having access to electricity. And whenever we have electricity, of course, we don't have it for 24 hours. Like in these communities, the majority of people are illiterate. We have a municipal hospital. We're very blessed to have it, but this is a building that used to be a building for an old political party. So it doesn't even have, like the proper infrastructure of a hospital. Just for you guys to have an idea, one of the OBGYN at this hospital, she had to wait for 9 years in order to have her equipment for her consultation. And at the end, it was one of our Finbricks volunteers who ended up bringing the donation. So there is for sure a huge contrast, like that affects definitely the quality of healthcare and quality of living in this community.
I couldn't agree more. What I find when I, in the past, have visited various FIMRIC project sites and the communities we serve, is that living conditions and the quality of healthcare, of access to healthcare in particular, is much different than what we have here in the U.S. or to your earlier point, Ashwin, in Canada. And Daphne, I think, did a great job of summarizing for you, some of the areas of opportunity that these communities have for improving living standards, quality of life, as well as, the quality of access to healthcare that they have. Having said all of this, what inspires me and keeps me engaged in a very passionate way about the work that we do at FIMRIC, and frankly, all of the various organizations in public health and global health that every day strive to support communities around the world in one way or another, whether it's healthcare or community development, access to clean water, any of these basic fundamental human rights, as I believe. What inspires me is really that the people I have met, the families I have gotten to know in the communities we serve are the most beautiful people in the world. It's one of those situations where you encounter a family that has so much less than you do back home, and yet you see their happiness, you see their love for one another. Often you see their service in one another. I worked in a different company in a startup that took patients from East Africa and the Middle East to India or Europe for medical care, for complex surgeries that weren't available in their local areas. And often these patients were being able to afford a trip of this sort to go get surgery by having pooled money from the communities in which they reside. And this is very common. It's more common than you would believe. But the individuals who we sometimes view as having so little, I can tell you from direct experience, they have so much in terms of their connection to other people in and around them, their shared experience of working through just incredible and unjust difficulty, but yet they are some of the happiest and in many ways the luckiest people I have ever met. So I have immense respect and appreciation for the members of our communities. So happy to share more, but just at a high level, when I think about living conditions and quality of life and so on, immediately our minds are drawn to the deficits and some of the gaps, if you will, between what we see in front of us when we're on a trip or when we're in the community serving and what we have back home. And while that's true, I challenge each volunteer that visits our sites and all of our staff, of course, continually to observe, as I have observed, the beauty of the people that we serve.
Yeah, it's especially really heartbreaking to see people that have less than you and have to suffer for things that we might find especially kind of commonplace and things that we can't imagine having, not having, or having to live without. And especially is kind of sad to see that they've had such less opportunities and also had more of a focus on kind of still being grateful for what they have. Because you mentioned how these people are still very happy and love each other so much. And it's definitely kind of just from our just way of living, we kind of associate our happiness with being able to just afford these resources or just having these resources within our reach. So definitely seeing people that are less off, we might assume, oh, they must be so unhappy. They must be so kind of just depressed or their family life must be terrible. But we still see that they still care for each other and they still love each other, maybe even more so than in certain places here. So that might kind of come as a surprise because, oh, it's like they have so little or they have so much less than us, but they can still kind of make the most of it and they can still kind of love each other and care for each other. And that's something that shows, I guess, just the human spirit and how even places that are less fortunate and have less resources, people can still support each other and still love each other. And it's something that's very admirable in these people as well, having this strength to be able to love each other and care for each other in this time, especially in areas where they're strapped for resources and not able to afford the things that we can. And I guess just keeping more of more recent affairs in terms of your operations and your actions. How has COVID been affecting your kind of your work and your operations and or even possibly Fimrix as a whole?
Well, COVID definitely, like affected our operations on site in DDR. I want to say that almost completely. From our current 7 active programs, the moment we're just running one, and this one is our diabetes and hypertension club. And we actually had to, limit or modify the program just to delivery of medicine, but without consultations. Whenever we're ready to open and start working, with the quote unquote new normality, we will have to modify, of course, like how we execute our programs inside and perhaps, start working with new protocols and determine which one is more important. Not that it's more important, but which one is going to be the order for reopening them. Not to forget, that obviously COVID-19 also affected our finances. I guess that limiting us in every single aspect and forcing us to make decisions that perhaps we never thought we would have to make, like closing the site like we just did right now for the DR and adapting our operations to the protocol and working now virtually like we have been doing. But I also want to say that COVID-19, changed Fimbric's strategy, and it doesn't necessarily mean that it did it for the bad. Since I think that having this opportunity, of working now or changing, of working with the volunteers on site and starting now to working with the volunteers virtually, we are learning a lot. We're just noticing that we can face these challenges as, I guess, like as individuals and also as an organization. We're tasting new waters and trying new things, like all together, learning in the process. But I really feel that we're thriving at the same time. So, somehow also, or something very interesting for me is that COVID kind of brought us together as an entire team because we are not all the time we're very or as in touch as we are right now with other FOMs, with other field operations managers. And thanks to these virtual programs, I think that we are starting to bond even more and to see our faces even more, and before perhaps we would just be okay with, oh yeah, we're just gonna have our phone calls and without the need to have our faces on a screen. And COVID didn't affect necessarily negative, our operations. Of course, that there are things that, you might be kind of not very happy about them. But if you really look at the bright side, we definitely have positive things with these changes.
Yeah, very much agree. And, what comes to mind when I think about what's going on in our world today and specifically as it relates to FIMRIC operations, I'll share with you a very personal story about the earliest days of FIMRIC. So when we first started, some of our first expenses were something I put on my credit card. And I remember having a balance of $30,000 and freaking out a little bit about, wait, how it was so easy to spend this money in getting the things that we needed, including, plane tickets and so forth, to go visit the sites and start to build some of the infrastructure and buy supplies and pay partners that were local on the ground and so forth. And I remember, again, sort of freaking out about not really having a good plan for how we're going to pay for what we had already spent. And a group of 10 of us, and I was in Washington, D.C. at the time, we were so committed to continuing the work that we had started that we discovered a program where charities could go and work at an events facility, a sporting events arena in DC. For basically at basketball games, you could man the concession stands. You could work at the concession stands, and so our group of 10 got trained and worked at the concession stands and sold hot dogs and soda and popcorn and other refreshments to the fans who were attending the game. And we did this more than a couple times. We did this a lot, actually. We did it. It was our Friday night tradition. And what ended up happening is, you just get into such a rhythm, and you're so passionate about wanting to move the organization forward. And so we went every Friday, and we sort of over time developed a mantra that every time someone passed something across the counter, they would yell, out to the rest of the group behind the counter what they were passing across. And you would sort of have a situation where someone would push a beer across the counter, and they would say beer, and everybody else on our team would say for the children. And the people, the fans, would look at us like we were crazy because we really weren't allowed to promote the fact that we were there. And they would just, they would give us these odd looks and these weird frowns about, beer for the children. Whatever do you mean by that? And so it really built a lot of team spirit and unity, and that team spirit continues today in the face of incredible hardship. Just in the world at large, and in the communities where we serve, and with our own team, it has been difficult. It really has. Our entire business model, and going back to the earliest of days, we realized that we probably had to figure out a better way to raise money for our charity than selling refreshments. It worked and it was great at the time, but we needed to think bigger. And so, that experience taught us that if we wanted Friday nights back, and if we wanted to, think bigger about the number of communities we could serve and the amount of infrastructure we could build, we really had to come up with a better business model. And, we had explored the idea of grants, and we've gotten several of them, over the years, but it hasn't been the majority of our revenue. In fact, less than 10% of all funding for FIMRIC comes from grants or personal donations that are not tied to a volunteer program. And so, frankly, the business model of the foundation has been people travel to our clinic sites, and they pay a donation at that time to help us cover the expenses of their trip and to cover the expenses of the clinic and of the staff on site. And in projects where we don't have a clinic, then to cover the health programs that we run either through partner facilities or in the community that are public health oriented and maybe don't require a facility. So all of this is to say that, the majority of revenue for the foundation comes from travelers, from volunteers visiting our sites. And now that's not possible. So we are definitely innovating in the moment. And as Daphne described, we have transitioned some of our volunteer programs to a virtual format. And Ashwin, I think that's how we all met, was you participated in one of those programs. And so I would encourage, if you're listening now, I would encourage your listeners to consider volunteering for a program online, virtually, through FIMRIC or through another organization that really does need the help right now to be able to continue delivering services in the communities we serve. Until at least it's safe to travel again, and so so for what it's worth, some history there, and perhaps even a plea.
Yeah, definitely. I'm very happy you shared that story with us. And honestly, as a member of the virtual program, I can definitely say that it's been something that I've definitely been the highlight of my summer so far, and is something that I'm very invested in. I feel very satisfied with this program, and something I would definitely strongly encourage to anyone listening. And definitely it is good to support this organization and what they've done. And being able to do this experience remotely is definitely an added convenience as well in facing COVID. And especially it would be good to sign up so maybe we could avoid having more refreshment sales in the future. And definitely, I guess maybe if if any beer is sold in the future, maybe we can think now it's for the children and have it go towards a better cause. And yeah, speaking about how COVID has affected your operations, and thanks again for the great story. How has COVID spread differently than you might see in these areas than in more developed countries, or has there been no difference at all?
Well, for me, there's actually a huge difference. I'm gonna try to share, like a few things that have been occurring, like in restauración. So I want to say that, yeah, definitely underserved communities have been more severely affected compared to developed countries, especially communities like Restauración and its surrounding communities, where people have had a hard time with one of the main rules of prevention, which is social distancing, and and hand washing, and due to the lack of water. So the lack of soap, even at schools, even before COVID-19, that was already an issue. Even at the hospital, it was hard to find soap. So you can prior to COVID, if we already had these problems, now imagine now that we have COVID happening. Just think of the DR as a country where you live with not just your immediate family, but you're living, with your cousins, your grandmother, and you already have a lot of people in the house. So now that you are supposed to start, applying social distancing, that has been very, very tough for people in the community. Then we have in the DDR a country where public transportation that basically consists, you would normally place, I don't know, 5 people in one car. And in the DR for public transportation, you actually fit 7 or 8 passengers in that car that is supposed to be for 5 people. So even if you don't want to touch the other person you have next to you, you have no option because that's the public transportation that you have. And I'm talking about, a scenario from the city, not even from a rural community. So this is just for you to have an idea of how it can spread differently. Actually, the very first case that we had in the municipality, it was diagnosed in a man. When he received the news, after he came back from the hospital, he went partying and drinking that night. And he refused to be sent to the city. He refused to be treated, people kept talking to him, but it was, I don't know, interesting to notice that people kept trying to convince him to go, but they couldn't be worried about the social distancing either. All of them, they were still at the park hanging out. So it wasn't until the National Guard came and they forced this guy, with cuffs, for him to be taken to the hospital into another city. So when the man was asked, aren't you worried about COVID? You are affected by it, you might die. And then he said, no, I am a man. I am a man and COVID is not going to kill me, but alcohol is just going to help me. So you have multiple factors of how COVID can affect, these areas differently, because you also have a macho cultural, at least for this type of community, or I want to say that even for most Latin countries, you have multiple factors and then you add the culture. And this type of reasons, not just allow the COVID to spread faster, but also differently in the sense that ignorance, it's also part of it, it does play an important role. And I want to say that maybe in more developed countries or cities, you might tend to find more educated people that might be more aware of the consequences. So people from underserved communities in DDR, they also seem to have lost faith in the healthcare system. So people are not going to the rural clinics or the municipal hospital because, they know that the hospital does not have specialized staff, or sometimes the medicine they need might not be available, the lack of medical equipment. And that is just for Dominican people. Then think of Haitian immigrants. And for them, it might be too expensive to end up paying for the medicine and the medical services. And sometimes the service is denied to them if they don't have any legal ID or any passport. So you can imagine if all these people are not attending to the rural clinics or the hospitals, the chances of contagion might multiply, like compared to developed countries because of all these reasons. And then I guess that inequality in general and inequity when it comes to access to health services, they contribute both to facilitate the transmission of any epidemic and to increase its negative impact. And then you place other factors such as the economical ones, and in communities like Restauración. And then we add one more item, like to the formula, which is a geographic barrier for Haitian people who cannot afford medical services in Haiti, but they cannot cross into our municipal hospital because now the borders are closed. So all this combination, can be lethal. And that's why I want to say that right now the work of every community health worker, it's even more intense. This is when you have them right now being very active because they know what kind of cure. They know the consequences. If people were already behaving this way before COVID, right now, this is exactly the moment where it's very, very dangerous.
Yeah, I would echo those sentiments and, share the perspective that in the world, there have been roughly 7.5 million or so cases so far of COVID, and roughly 420,000 or so deaths. And unfortunately, this is a point in our world's history where these numbers may not be the extent of disease burden that we're seeing as a result of COVID. And when we look at the countries where FIMRIC operates, in countries like Peru and Ecuador, the Dominican Republic, these countries in particular that I've mentioned just now here, have been disproportionately affected compared to places where testing is far more limited and access to health resources and the terrain is in many cases far more rural in nature, and so for example Uganda and so forth. It's one of those situations where it's really a consideration of what's going on in each country at a given moment, and I think we're early in understanding not just how the virus evolves over time and mutates and so forth, and the disease burden that it causes. But I think we're early in also understanding, to Daphne's points, much about how different, we have our global society, and then we have, many different cultures that are relevant in how we engage patients in each of these areas, or how we engage people in each of these areas, to explain to them the risks, to help them understand what behaviors are most consistent with avoiding falling ill or making the rest of your family ill if you are ill. And it's difficult, right? Most of the communities we serve do not live in multi-room houses or buildings. They're often living in accommodations that are much smaller for an entire family than is necessary to appropriately prevent disease transmission to the rest of the family. And so there are so many considerations to make when you are pursuing a public health strategy in different parts of the world based on cultural factors, again, as Daphne had mentioned quite well, I think, but then also based on what's reasonable for this environment at this moment in time, right? Because it's not just a single approach that consistently delivered will yield the right results. It's one of those situations where you really need to understand what's going on in the country as a whole and the community as a whole to be able to appropriately design an effective public health strategy. And so it really is quite different in the various countries, 10 or so, that we work today. So much more I think we could say on this topic, but at a high level, I think we're still early, only a couple months in terms of the U.S.'s journey, in terms of sizable numbers, right? Of course, having started in the January-February timeframe for us, and earlier than that in other parts of the world. But I think some of the countries in which we work are just now, unfortunately, starting to have sizable numbers of cases, and that's going to be something we watch closely over the next several months as we design strategies and participate in the government's response and the local government's response, and other organizations like FIMRIC that are doing the best that they can to educate and to disseminate information that's really critical at this moment.
Yeah, definitely just the flow of information and how this has been unfolding is definitely important, and conveying to citizens just across a global scale. And definitely, unfortunately, we can't say ignorance is something that can be associated just with low resource and underserved areas as well, because we've definitely seen cases in more developed countries where we think people would not have the ignorance to just kind of just walk around or just kind of aimlessly spread viruses or just diseases in any scale has also been shown. So it's definitely something that's worth tackling as well on a global scale, as well as considering these lower resourced areas as well. And considering this pandemic as well, do you think these countries have been well off enough equipped in handling this pandemic, or do you think there is more to be done and more service to be provided to these countries in wake of what is currently happening?
This is such a controversial question. I can guarantee that if any politician or my own president listens to this, he might disagree with me. But if you want my honest and humble opinion, I don't think that any hospital in the world was actually well equipped to handle this pandemic. For me, it's more related to how fast the countries responded, to meet the demands. But speaking just for Latin American countries, I really feel that for many countries, this was still not an option. I also kind of feel that the answer, it's not very simple, among other things, because for me, health spending is not, it is not the only indicator to take into account when you evaluate a country's ability to cope with an epidemic such as that of the coronavirus. I guess that we saw, how emergency hospitals, were built at full speed in China. Then we have European doctors facing dilemmas of which patients they should prioritize, and governments, ordering private medicine from other countries, etc. But I guess that for Latin America, or we already had a hard situation even before COVID, and the test of this pandemic has surely been or hit us harder. In our countries, we already had much more complex health situations where, we have far fewer resources that are destined for public health expenses. So for our authorities, I want to say that they had to cope, with the new coronavirus already in much more difficult conditions than their, I guess, European or American counterparts. I really think that there was already an unequal access in types of pandemic. And obviously we have seen this, how countries, just like Vic mentioned before, where we even have FIMRIC clinics. We have Bolivia, Nicaragua, Haiti, Honduras, Paraguay, Venezuela, all these countries, they already carry more risks. Of course that, a high expense on public health, however, does not mean that it's an efficient expense, because of course that your resources might not always be equitably, I guess, distributed. For me, I feel that all this must be taken into account when you evaluate the capabilities installed in Latin American countries. If we already had insufficient resources to cope with an epidemic, then you add the situation that we don't have enough beds, even before COVID. Then we don't have enough tests. And when the tests arrive, the price is very high for patients, and for them, it's like, okay, I either pay for my COVID-19 test or I bring bread to the table, because not all the people from these countries are actually receiving, aid from the government, perhaps, like people living in US and Canada. Just imagine in the DR, they are only getting $100 per month. In Mexico, people are not receiving anything from the government. So if you didn't have any savings, well, sorry for you, but the government is literally doing nothing, to support people. I guess that the total number of available physicians, hospitals, or teams might be an adequate way to measure, effective response. But we also need to add the trust that the inhabitants have in their governments and the education of the inhabitants to respect the protocols or lockdowns. Because like we were just discussing in your prior question, the level of education or ignorance does play a really, important role. As long as people are aware of which ones are the consequences of this, pandemic, okay, maybe that's how you stop, the spread or the contagions. And you don't have to reach to that point where you have to hospitalize all of them. But I personally, I don't know if Vic will agree with me, but I really don't think that any country was well equipped before COVID.
Yeah, I mean, I think I wholeheartedly agree with you, Daphne, and I will significantly limit my comments here because what we need to focus on is next steps. And unfortunately, no country, to Daphne's point, was well equipped to handle the type of virus that coronavirus is and to be prepared enough for the number of patients who have needed care and frankly will need care. And so I think our focus as an organization and frankly as a society at large is to figure out what we need to do to be better prepared for patients who are going to need our help over the next 6 to 12 months in particular. Really until an effective treatment or a vaccine is developed, we have to do our best to allocate our limited resources and move those resources around the world, not just within each country. And I don't, unfortunately, see the type of collaboration I would like to see at the scale that I think we need to see it. And so I am hopeful when I see some of our clinical leaders like Dr. Fauci and Dr. Birx and many others here in the U.S. And then some of our global health leaders around the world. I'm encouraged that they are making the right decisions and guiding the public in the right way. And I would emphasize that we should continue to follow their guidance and their lead and their recommendations, both here at home and abroad in the communities that certainly we serve, to the best extent possible, to equip our communities to deal with what we know may ultimately affect them either now or in the future. So some of what we're doing today might be in preparation for other diseases that may arise over time. And so I think anything we can do today to create some of that impact and some of those pathways for dissemination of information and education is crucially important. But no, to answer your question, very succinctly, no, I don't think any country is well equipped to handle what coronavirus and COVID sort of have become.
Yeah, definitely. It's really important, especially to look at next steps moving forward, because we can only kind of just dwell on how long, and just dwell on just this topic of how long or how enough resources were managed, or if there were enough resources to begin with, or just kind of the systems. And it's definitely what's important focus to now on is the next steps on how to manage what we have right now and to ensure that something like this doesn't happen in the future. Because I know that especially we like to think of our healthcare facilities and healthcare systems around the world in places that are a lot more kind of sophisticated and more advanced, to like in the US or in Europe or Canada or just anywhere like highly developed countries. We like to think, any pandemic we would definitely be able to handle, or our healthcare facilities definitely wouldn't fail in spite of this new wave. But we see that as soon as it started and right away we saw hospitals being hit very hard, strapped for resources, unable to keep up with the supply, and there were definitely not enough measures being taken and a lot of reluctance by political figures. And there was a lot of different factors that went into kind of the combinations of failures that occurred, and looking at these failures and seeing how exactly they went wrong and ensuring that this doesn't happen again in the future is definitely very crucial, because we could have, in the future, we could avoid many deaths and many hospitalizations if these precautions are taken in the future. I guess as a final just kind of question for this episode, do you have any final call to action or any just kind of final words or anything you want to say for any listeners that are listening right now, just as a kind of a final point or something you want to leave to the viewer to think about or to act on?
Sure. I guess that all this that has occurred has definitely, changed people's lives. And among some realizations, I think that one of them is that the pandemic has proved to the ones, especially for the people that do not work in public health or the medical field, it is until now that I guess they start to pay attention of how important it is to, invest or pay more attention in everything that is related to prevention, just to keep making more emphasis. Especially, for those countries that just destine a small amount of money of their, a small percentage of their GDP, to health and science. I think that, I guess that my call to action would be, or the lesson that I would like the coronavirus to leave is to start paying more attention that, a good reminder in the very first place or the first line of defense against the COVID-19, it was a simple hand wash gesture. And that simple gesture is not yet available to everyone, not just in Latin America, but in other countries, because they don't have still access to potable water. We're just talking about, water. Definitely more policies for that are needed. I'm not even saying, let's just make sure altogether that every community has a top-notch hospital. I'm just simply talking about access to water, The call to action is not just for policymakers or for people in power, but I guess, to try to encourage every single individual that is interested, in this field or who is not interested in this field, but to try to take some time to think how this universal/human right, that could have definitely prevent and can still prevent many diseases and help us to cope with any pandemic. It's still not, a right for every single person around the globe. So, I guess that my dream could be, for every person that could, support organizations, not just like FIMBRIC, but any other organization whose purpose is to work at grassroots and, keep educating people, keep making sure that we all have access to water, that would be beautiful. So not just, again, for policymakers, but for every single person, because seriously, for me, this is something that really shocks me, a simple hand wash gesture can save so many, troubles. And this is still not something that people can afford to do or have the luxury to do.
I think my call to action is probably a bit different in that I would ask people to commit to putting aside a portion of their week, their month, their year, every week, month, or year to be in service of others. And I think there are so many ways. Sometimes, people are not aware of the multitude of ways that they can serve other people. But at the core, at the end of the day, we all have a responsibility to each other. And right now, in some ways, the responsibility is to stay away from other people. But that's not always the case. And so we want to be able to, even when we have to socially distance, we want to find ways to be in service of others. And that can be, Ashwin, what you're doing today by spreading awareness. It can be through your various social media efforts in sharing information, correct information, and helping to promote the best practices and make that aware to people in your neighborhood, in your community, so you can have local impact to people around you. If you aspire to have broader impact, it can be to those in the region in which you live, or it can be halfway around the world. And it doesn't have to mean giving money. So it really just means getting involved in some way, shape, or form. If you're a religious person, it could be through your church community, or your temple, or your synagogue, or your mosque, or whatever community you belong to. You can find a way to be in service of others. And if you're not religious, there are plenty of other ways to get involved as well. So organizations like FIMRIC and many others that are out there doing great work, they are in constant need of volunteers and support. And there's no limit to the impact that all of us together can have for the betterment of society. So whether you spend an hour calling a senior in your community who might be suffering from loneliness, or helping to deliver groceries, or to do things that we need to do right now to make sure those who are vulnerable in our communities are looked after, that's what I would, that's the call to action I would encourage you to consider. And then if it's halfway around the world, it could be sending postcards to communities, letting them know that they are loved, they are thought about, they are cared for. Simple messages of this sort, which plenty of organizations can help you coordinate how to let your impact be realized. But find a way to be in service of others. I guess at the end of the day, that would be my single call to action for anyone who might be listening.
Yeah, thank you for your words and your time. And thank you for listening to this episode of Global Health Direct. You can get more information on the Facebook page at GH Direct. I hope to see you in our next episode where we continue to focus on global problems by getting local perspectives.